All right. Hello, everyone. We're going to wait a couple minutes here and then we will get started. Thank you very much for joining. All right. We'll give it about 30 seconds here. All right. We'll get the show on the road. Ted, you can hear me okay, right?
Yes, I can, Andrew.
All right. Well, good afternoon, everyone, and thank you for joining us for our webinar today. And Ted and I were just talking, and with the Medicare deadline coming up, we thought it would be a perfect time to walk through changes for next year and also give anyone who may be running a little bit late the information that they need before the December 7th deadline. Uh, we're joined by Ted Wallace. He's been an awesome resource to our clients and someone that I'm excited for you all to learn from. He is a wealth of knowledge, and he's just someone who is an independent broker that can really, what we found is work for our clients, work for the insured rather than working for the insurance companies. And we're so grateful to have the partnership with him. Just some quick housekeeping things. I'll be monitoring the chat as we go. So if you have any questions, feel free to throw those in there. And then we'll reserve some time at the end for questions and answers. And I promise you, anyone here, your questions are all welcome. I'm sure if you're thinking it, other people will be thinking of it. So we'll keep it light. We'll have a good time here. And Ted, I'll turn it over to you.
Thank you so much, Andrew. I appreciate that kind introduction, and the collaboration with you and folks at 12 Points has been great. Thank you for making the point of the annual enrollment period, which started October 15th and will run to December 7th. As you know, Andrew, we're talking to people about this throughout the year as folks turn 65, or they may have changes if they delayed their Part B. So it is a particular time of year where it provides us a lot of flexibility with Medicare Advantage and Part D prescription drug plans to help people figure out what may be changing for next year based on their annual notice of change. So I agree, this is a very timely discussion. And hopefully folks have most of what they're thinking covered, but we're here to support people as we get to the deadline. Thank you for making the distinction of independent broker. What a lot of folks don't even know that this position even exists. What it allows folks like myself to do is become contracted with multiple insurance companies so that we can compare and contrast networks, doctors, benefits, as well as copays when it comes to prescriptions to provide recommendations for clients. So for today, we'll move through this a little bit quickly here. What is the 2026 plan year in turmoil? What's going on with that, right? So the title slide was Medicare Madness. Had published an article in Financial Advisor magazine back in August of what we might expect for this year. And there are a lot of changes. So we'll get into that a little bit. Your annual notice of change, why that is so important as a beneficiary. Out of all the spam and all the solicitations you get, that is a legal document that needs to be provided by the insurance company that talks about your changes for the upcoming year. It would have arrived in folks' mailboxes by the 15th of October. Generally, they try to have them out. Some resources available to you as members and places you can go to find credible information. Talk a little bit about original Medicare, just so everybody understands what that is and what it does and where some of the gaps may exist. Your two main options for coverage. There's a lot of marketing, there's a lot of sales material, there's a lot of news. We'll kind of distill things down to folks on the two main products. Your Part B premium, unfortunately, but surprise, surprise, those are going up a bit. That's your Part B premium for Medicare. We'll talk about the new number. We've got some new numbers here throughout the presentation for folks so they can get that update. Part D, how the prescription drug plan works, how someone like myself and someone like Next Stage Benefit works with folks, and then also how we collaborate with Andrew and 12 Points from a financial planning standpoint to be aware of some costs that might be associated with your healthcare, and also that time frame when you might be in a distribution phase. And then lastly, what a proper plan comparison looks like and some Q&A. And we're going to move through this somewhat, I don't know if quickly is the right word, but we're going to move through it because it's kind of dense and we want to keep things moving along. So the 2026 plan year, here's a couple of headlines that we had as it related to different networks. There was a lot of coverage in the Boston Globe this year. There's also some headline here from the Concord Monitor up north. So what I spoke about in that article and what we're starting to see is a confluence of macro headwinds. So basically, we came out of the COVID years where the insurance companies were very profitable because very few claims were filed because you didn't want to go to the hospital for an elective surgery. The way that the Medicare Advantage plans work is they are reimbursed from the federal government, and they are required that if they have a very profitable year, a certain amount of that profitability needs to go back into the plans. So essentially, we came out of COVID with profitable insurance years and therefore sort of inflated plans with lots of benefits. I saw some crazy things, green fees being paid for. Nice to have, but I don't know if that really belongs in a healthcare plan. But that was generally what we saw out there as far as plans, PPOs with all kinds of networks, very favorable cost sharing. So as we came out of COVID, everybody signed up for these plans. Now we saw claims start to increase exponentially because all the folks that had waited were now going in for their claim. Subsequently to that, inflation and wage increases in the healthcare industry have gone on pretty much unabated, even while the rest of the economy kind of equilibrializes a little bit and finds an equilibrium out there. Healthcare is still continuing to rise in costs. So this confluence of factors has really created a tough year. Here in Massachusetts, because that's where we are today, we're a little bit insulated, but we saw a lot of changes with MGH in their networks and having PCPs out of network with United Healthcare and also with Blue Cross Blue Shield. We saw a lot of changes with Blue Cross this year where they've pretty much been a bellwether. Up north in New Hampshire, there are 75,000 people that need to find a new Medicare Advantage plan by December 7th. Well, actually, if they had their plan terminated, they have an extended period, which is good news, but certainly by January 1, so that they don't roll back onto original Medicare. But I don't think the Concord Monitor used the word incorrectly when they said it's a crisis up there with our neighbors in the north. So after all those profitable years, all the costs that came in and really belt tightening around what insurance carriers were going to do, this is the trickle-down effect. Some plans being canceled, some being terminated, some networks having further restrictions, and then the nice-to-haves like the vision, dental, and fitness, we've seen those get constricted as well. So that's a little bit why we're dealing with so much disruption this year. So that's on the Medicare Advantage side. On the supplement side, and we're going to talk about Advantage and supplement in a minute. On the supplement side, while those benefits are consistent year to year, the core benefit in the supplement product, people are going to experience premium increases. Here in Massachusetts, there were folks asking for the highest increase available, which is 10% because it's regulated by the state. But in other states across the country, we're seeing high double-digit increases in premiums. And that's causing some insurers to leave certain states and some not offering plans altogether. For standalone prescription drug plans and other drug plans in the Medicare Advantage products, we've seen more of an introduction of a co-insurance versus a copay. What happened there was we had the donut hole in 2004 get eliminated, and we had a cap on prescription drugs of $2,000. So the donut hole went up to $8,000. The new cap was $2,000. So where did the $6,000 go? Who made up for that? Well, they were hopeful that the insurance, the manufacturers, and maybe the government would kick in. And what we saw was a lot of the insurance companies carrying the bulk of the cost that was basically not accounted for with the new regulation. And that has forced them to kind of have some of those costs trickle down into really everybody's plan and how they're trying to manage their overall cost for their entire insurance pool for things like prescription drugs. For Medicare Advantage, we went through it a little bit. We talked about some plans being canceled, some PPOs leaving the market, or their PPO benefit in co-insurance for going out of network has really skyrocketed. So even though a plan looks like a PPO, the insurance company really wants it to function as an HMO because they don't like they have a hard time controlling their costs when folks go out of network using the PPO. Some plans have introduced a monthly premium where there were zero before, and to reiterate, a reduced dental, vision, and hearing, and some other benefits. And then lastly, we saw our Part B premium that gets paid to Social Security rise from 174 or 170, no, 185, that was the prior year, up to 202.90 for next year. So, what can some folks do? The number one thing to do to remain a smart consumer or an informed consumer is to look at that annual notice of change that I mentioned. All the insurance companies are required by law to send this out so that folks are aware of the changes for the next year. This is important for a couple of reasons. One, they'll have a side-by-side, and I know this is probably small for some people to see. This is just a scan of one annual notice of change, but a side-by-side of what 2025 looked like with the core benefits and what 2026 is going to look like so that you can make an informed comparison and then decide if you want to go and shop plans and see if there is something that's going to be more comprehensive for you. So this is your tool to decide if you want to go shopping. I highly recommend going shopping these days because the consistency from year to year, as it was in the past, is just not there. Secondly, if you had a plan terminated this year and it's not available, this notice and the notice that your plan is terminated is going to serve as your evidence to insurance companies to get a guaranteed issue into different products if you are not in a guaranteed issue state. So this is a very important document to hold on to. I know I sit down with folks, I go into their homes, they have piles of paperwork. It's ridiculous. This is one of the things to hold on to. Moving on to, okay, so maybe I am going to shop around a little bit, or maybe it's my first time looking at a Medicare plan. How do you choose the right path? Well, the number one thing I tell people, Andrew, is it's not just picking a carrier. You want to pick a plan that's going to address your individual health needs, how much you may be accessing certain services or how little, as well as what does your prescription drug list look like? What do your copays look like? Where does your PCP sit inside of these different networks and what hospital systems, and making sure they're in network if you're going to go with a Medicare Advantage plan? The considerations of just your overall budget. So this is something we talk about in retirement planning, and Andrew and his team are awesome at this. Like, what's the budget going to look like, and how do we cost out what health expenses may look like in retirement after we either retire or retire and leave our group health plan? And what other considerations should we make? And we'll get into the income-related monthly adjustment amount in just a minute. But the last two other considerations here, what's your lifestyle like? Are you traveling throughout the United States? Are you in Florida a few months? Are you in California a few months? Are there plans that are better suited for that? And then lastly, and there may be folks on the phone today, and I talked to quite a few people, even if they turn 65, they may have a group benefit because there's a lot of people working past 65 that have health insurance available to them. So how do you look at what the group plan that's afforded to you through your employment might compare to a Medicare plan? And can you delay your Part B Medicare without getting a penalty? What are the specifics around that to make sure that down the road when we're signing up, we don't have this surprise that we have a lovely penalty from the federal government showing up. It's tough when I have to have those conversations.
And Ted, what would you say is like the biggest headache that people run into when they go on to Medicare and thinking about prescription drugs or things that people should keep in mind?
I would say, there's a slide here where we talk about the government side of things and the private side of things. And what that means is government side is Part A and Part B. So your Medicare A and B. And what are the rules around signing up for that? If I have a HSA, when can I continue to contribute to that if I'm signing up for Part A? Should I sign up for Part A or should I delay that as well? Number two, when signing up for Part B, if you are delaying that because you have group insurance afforded to you from your job, what forms need to be filled out? What are the nuances of the forms? What are the little mistakes folks make when they're filling that out? So that when you submit that to Social Security, it's submitted correctly, because trying to claw that back is kind of a nightmare. So those are the biggest ones. Like, let's get it right the first time, especially when you're working through things. Social Security offices are busy. We just got through government shutdown. People are backed up. There's backlogs. So making sure those forms are done correctly and we're taking the right steps, that's probably the biggest challenge. Once that's complete and we have our A and B in place and we're good to go on that side, generally the private side of things happens pretty smoothly. They're eager to have your business and eager to get informed new members on their plan. Is that helpful?
Yeah, thank you.
Now, here are some resources. Great question, because here are some resources people have available to them. Medicare.gov is a great site. I use it quite frequently. They have a tool on there where you can look at multiple plans and compare them. You can input your drugs and quantities, etc., and get your prescription estimates. There's the Medicare and You book. That is a resource, but I always joke, hey, it's a 130-page instruction manual. What could go wrong? And as you actually peel that back, Andrew, you'll see certain sections. When you read it, it says, okay, refer to section 9. Well, you go to section 9, and section 9 says to refer to section 16. So that's an interesting one, but I do tell people to hold on to that. Their state health insurance assistant program, anybody who works at CHIP volunteering their time to help people figure this out, those are great folks. There's also a captive agent, right? And this is kind of the inverse of an independent broker. The captive agent are the folks that are inside the insurance company. So if you call the insurance company number and you want to learn about a plan, you can speak to them. The only caveat about that is those folks can only speak about their plan. They're not licensed across multiple plans. And then, of course, the distinction that we made earlier around an independent broker, there are lots of folks like me that are out there. And, I think from my experience in the industry and different associations, folks are well studied in that space. All right. So we're about 19 or so minutes in. What is Medicare? So just for a quick, honestly, this stuff is so confusing. I call it alphabet soup. Medicare is alphabet soup, A, B, C, and D. And my point was going to be that folks are signed up for this and they still don't quite understand, like, what am I even signed up for? So just very bare basics, down to the studs here. Part A and B, you'll hear referred to as original Medicare. In your A is going to cover hospitalization, and I tell people to think of that as overnight. If you're staying overnight, it's probably a Part A service. Part B is going to be your medical expenses. So it's going to be doctor's office visits. This is infusions within a lab or a doctor's office setting. So there's this thing called Part B drugs that are different than Part D drugs. Durable medical equipment, labs, those fall under Part B. Part D, I'll jump to, is going to be for your prescription drugs. So just remember D for drugs. That's probably the easiest. And then we have Part C. And I'm not sure who labeled all these this way. I don't think I would have done it the same. But if you're looking at a Part C program, it's going to include almost all of the time your A and B benefits plus your D benefits. And they wrap that into a plan called a Part C, and that is synonymous with Medicare Advantage. And the other thing, Andrew, is like people think these have been around forever. 1965 was the original Medicare, and then 97 was Part C. So that's like in its infancy as far as government programs. And then D was 2006. So these are still pretty new in relative terms.
Yeah, I was shocked by that.
Yeah. Yeah. So as we jump into original Medicare, what's it going to cover? Okay, I have my premium-free Part A because I paid into it for 40 quarters, so it's not exactly free. You did already pay for it. But for Part A, you have 100% coverage for your first 60 days in the hospital. And what they mean by that is that's all the services that happen within your hospital stay. Hopefully you're not in there for 60 because that would be not a good sign. And then they cover 100% of your first 20 skilled nursing days. Skilled nursing, the thing I attribute to it most that people recognize is like rehab. So if you had a stroke and then you have to go into rehab, get back on your feet, and that would be an example of a skilled nursing facility in how you could spend those days. So for every Part A hospitalization, you get that benefit, but you also are out of pocket $1,736 for 2026. And that's a per occurrence, meaning if you go into the hospital, you pay your $1,736 and you're released. If you are back in the hospital within 60 days for the same, no, beyond 60 days, even if it's for the same issue, you're back out of pocket another $1,736. Okay, moving on to Part B, medical services. This is our new premium for 2026. There's a little typo here. This is $202.90, not 50 cents. And that is monthly, paid to Social Security. And that is the base rate. And you'll see our note, it's based on income. So something that Andrew and I collaborate on is income-related monthly adjustment amounts and helping people understand that. We'll talk about that in a subsequent slide. But that is our new increased rate. Last year it was 185. Your Part B deductible went up from $257 to $283. And what this is going to cover for you is 80% of your Part B services. And that'll apply to outpatient surgeries, infusions, labs, ER, doctor visits. There's a lot of things that fall under that category. And it's nice that 80% is covered. However, that will leave you exposed to the other 20%, which theoretically has no limit. So what it doesn't cover, if we stay on Part B here on the right side, is the 20% is out of pocket. Places this really adds up, things like chemotherapy, infusions, labs, it can be crippling. For Part A, first you have that deductible out of pocket, but then secondly, if for some reason you're in for more than 60 days, you have a $434 per day copayment. So we're already in a bad predicament because we're in the hospital for 60 days. Now, on top of that, the register starts kicking in. So I know for us, what we're trying to do here and what our jobs are to protect people from some of these real financial crises. This could be a real tough situation. So we want to make sure people are covered well. And then lastly, this Part D prescription drug plan piece. This is the Part D piece is no prescriptions are covered by Medicare. If you have any, where you go to CVS, etc., that all has to be under a separate plan. So what are your options for coverage? All right, back to this slide. So earlier I said there's two main things that people can do for coverage. You're going to hear about a million different things. There's two main things. One is original Medicare, A and B. plus a supplement, a Medicare supplement. Now, the term supplement is synonymous with a Medigap. Okay, I know there's all this terminology flying around out there. It's very confusing. Supplement and Medigap are the same thing. And what they do is they supplement or fill the gaps of where we're exposed with original Medicare coverage. Now, to marry with that, a prescription drug plan to cover your prescriptions. And that's necessary because you're going to get a penalty for that if you don't sign up for a Part D plan, even if you take one script or no scripts at all. A lot of folks don't know that. And the penalty is for life. I have no example of anybody ever getting out of an appeal with that penalty. So what's great about the supplement? Okay, pros and cons. Higher premium. So every month it's considerably higher. In Massachusetts, it's probably about $200 to $250 when people first start Medicare for a supplement one versus many plans are $0 for the Medicare Advantage side. So higher premium, but for that higher monthly premium, there's very few, if any, out-of-pocket expenses. You have your $257 Part B deductible. They're accepted nationwide, so anyone who says that they accept Medicare payments, this is really neat. They're obligated to take the supplement plan because the mechanism for it is really they send their bill to Medicare, Medicare pays their percentage, and then they send the balance to the supplement plan to cover the balance. So this eliminates the whole network conversation. About, I think the last figure I looked at, 97 or 98% of all physicians in the nation take Medicare. So that's really helpful. There's no prior authorization mechanism, which is pretty neat. So you talk to your doctor feels as though it's medically necessary, and you want to move ahead with the procedure, Medicare will approve that procedure. So that's pretty nice. These are offered by private companies, the supplements and the Medigap plans. What is interesting, you'll see some little ancillary benefit, like a discount to a gym or something like that. But outside of those little tiny ancillary things that they try to catch your attention with, all the core benefit is the same. But guess what isn't the same? The price isn't the same, Andrew. The premiums are all different. So why is the premium different? Here's the thing to look at with these plans. You want a company that's been around at least for 5 years, because that seems to be the general litmus test of if they know how to operate an insurance pool so that they're around for the long run. In many states, they're alphabetized. In Massachusetts, we have a core plan, a 1, and a 1A. That's just a little distinction. Outside of Mass, Minnesota, and Wisconsin have their own way that they categorize them. Everybody else is kind of like an alphabetical naming convention. Another kind of a con, I guess, is you have to have your own standalone Part D prescription. And then if you want any dental, vision, or hearing, that's all separate as well. In most states, and we're going to get into this about Massachusetts, this is really important for people to understand. In most states, your first 6 months of Part B eligibility is your guaranteed issue time. Meaning, to get into this insurance product, your first 6 months when you sign up for Part B, they can ask you no medical questions or medical history. They have to issue you the product. After those first 6 months, you can be subject to medical underwriting, and they can raise your premium or they can deny you the coverage. So it's a pretty big decision there in the beginning, and one that should be thought of. All right, trying to keep it moving here, moving along. Medicare Advantage. I know that some of this stuff is dense. I can't believe how fired up I get about it. Any questions,
No
Andrew?
questions. Yeah, no questions. No questions at this time.
Okay, great. Your secondary option, remember I said there's two. So you have the supplement / Medigap in a Part D plan. Secondarily are your Medicare Advantage plans. And what's kind of neat about these? Well, there's a few things. One being they're going to take your A, B, and D and wrap it into one card. Usually people just roll with one benefit, so their prescription to their doctor, etc. So it's a little bit less to manage. They function very similarly to a group plan if people are used to that kind of insurance. So you might have a little deductible, a little copay, you have a max out of pocket. So people are used to this kind of product, and it's a quick learning curve. Um, they are very cost effective. Every plan that I've written for the last 6 months is a zero premium. There have been the introductions of some small premiums, and I think that might continue heading forward before we kind of get through the eye of the storm here and get to the other side. Um, but they'll also wrap in some dental, some vision, and some hearing. That can be really helpful. And a lot of these plans, whether PPO, and there's even some HMOs that don't require referrals, which is kind of neat. And I think Medicare Advantage, it's like, oh, it's a managed plan. Sometimes they get bad press, but all these things are regulated by the Centers of Medicare Services. They have to meet a certain criteria. When you sign up for these, you sign up that the information from the plan is going to be shared with Medicare. So they keep a close eye on all this to make sure there isn't like massive disenrollment and people seem happy with the plans. Okay. Another important point. This is like one of the golden little nuggets. If you're in Massachusetts, Maine, New York, or Connecticut, there is a function around guaranteed issue. I'm going to speak specifically to Massachusetts. It's the most comprehensive one. I spoke earlier about Medigap and Med Supplement, and in the vast majority of states, you have your first 6 months of Part B eligibility for guaranteed issue. In the state of Massachusetts, that guaranteed issue into a supplement continues with you until your last day. So what is interesting here is when I sit down with folks, depending on what state we're in, we have a different strategy about how we think about Medicare and insurance and planning. And this allows us, when you're with one of these guaranteed issue states, obviously some more flexibility around what choices we make, because we're going to continue to have choices for years to come. That's an important one. Okay, Part B premiums. And I promise folks we're getting there and we're covering a lot right now. So as Andrew said, if people want to connect post, well, we'll be around. 2026 went from 185 in 2025 to 202.90. And we're going to talk a little bit about IRMA planning. So Andrew and I talk about folks that they're doing their financial analysis. And what a lot of people don't know is there is a surcharge on your Part B premium, and folks call it IRMA, Income Related Monthly Adjustment Amount. I'm not trying to kill you here with too many acronyms. So depending on your modified adjusted gross income from 2 years prior, that will impact which bracket you fall in whether or not you'll have an additional surcharge on top of your 202.90 Part B. And as we get further along in the brackets, there's also a surcharge in your Part D. So like Andrew and I will talk, we have people coming up, we say, okay, what's the income looking like? How do we tweak the levers? Because as Andrew will say, like, we try to keep an eye on this so that if you're going to go over, and I've had this conversation with clients, if you're going to go over, make sure you go way over. We just don't want you over just a little bit, right? Because then you get the surcharge and you're just a little bit over the bracket for the year. So if we can figure out that planning, we like to. Anything to add there, Andrew?
No, I think this is the tricky part here is you're looking 2 years back. So people often come to us and say, like, how do I figure out what it's going to be in 2 years from now, what those brackets are going to be? And we always try to just be conservative, use what the current brackets are to figure out, are you going to have to pay more of that premium? And that's the best we can do at this time when it comes to planning for that.
Yep, 100%. And hey, Andrew, I'm thinking of selling this secondary home. Like, how does that play into, how that might affect capital gains? And this is a conversation too with CPAs, right? That folks need to be a little bit informed, but we are always telling people to be proactive, ask a lot of questions, engage your financial advisor, engage your CPA, because it can mean a lot. And even at a very basic level, some people don't understand that this even exists. So let's get you educated to the fact that if this cost is going to be there, let's think about how to plan for it and budget appropriately.
Yeah. And to your point, there are forms that you can fill out to get an exception. Like if, again, if you had sold it, say in 2024, you had sold your home and got some sort of capital gain, that's going to impact this. And then you can file forms to fix what your premium would be and basically tell the IRS that this was a one off. So that's all I have here, Ted, but appreciate you calling this out.
Yeah, no, that's awesome. That's great. This is a big one. And believe me, like I feel for people when we talk about this, they look at me and they say, "What? How much is Medicare going to cost? I'm in the top two brackets." And it's a tough pill to swallow because we all know we're working hard to achieve whatever financial success we have. And it's tough sometimes when they keep coming for more. But all right, prescription drug coverage 2026. I literally just got off the phone with a client prior to this. We were going through this with a rep over at, I won't name the insurance company, I'll probably get in trouble. But there are three main phases. Well, what the heck is this, Ted? And these are folks that have been on Medicare, business owners, really smart people. They've been on Medicare, they're in their 70s, a while now. So there is a deductible phase. The maximum for the deductible phase is $615 for 2026. So when I go into CVS and I pick up my first script on January, I have to chew through and make my way through the $615 in copay in payments, because it's not even a copay at that point, it's all out of pocket. And once I hit the $615 deductible, then I move into my initial coverage phase, which in general terms, and I hate speaking in generalities, but there's just so many things to cover here, you're at about a 30 to 33% share with your insurance company. So the insurance company picks up about 70%, you pick up about 30. Now, we have our $2,100 federal cap on prescription drug costs for next year. How do we get there? That is your deductible out of pocket plus your co-insurance out of pocket. And if you reach the 2,100 for covered drugs, meaning drugs that are on the insurance carrier's formulary that you signed up with, you will therefore have no more drug costs for the year when you hit the 2,100 out of pocket maximum. Now, there's a lot that was a mouthful. So again, I don't want to get too in the weeds here. So if you have questions on this stuff, folks, reach out. Here is my government side and private side. So how do we help people? Geez, Ted, well, how the heck you work with people? So on the government side, we help people figure out, how do I get onto SSA.gov and open up a portal so I can do some of my interactions with Social Security there and sign up for things? What's in L564? L564? Well, that's the form that you submit to your employer, and they're going to help you fill it out. So it's going to show you had creditable coverage while you delayed Part B, and therefore you are not going to be due a penalty. These are the forms that we fill out when people start to make the decision to move over to Medicare. Just general signing up for A and B, and then the IRMA appeal, which Andrew mentioned. If that is going to work for a client, we can help them locate that, help them figure out how to fill it out, and guide them through that process. On the private side, if you got an annual notice of change, we can help you review it, look at it, make sense of it. We can help you run prescription drug costs inside of your Medicare Advantage plan if that's how you're receiving them, make sure they're staying competitive. We can do plan comparisons across different providers and show you and walk you through the differences. We can talk to you about complementary products that may exist that you might be interested in to help continue to kind of shore your protection up from the insurance side. And then lastly, we do a lot of work around just making sure a primary care physician that's a PCP and specialists are in network with whatever plan you might choose. And lastly, if you are out there, whoever you are working with, this is what a proper plan comparison looks like. I know it's small on the screen, but everybody should be showing you what a Medicare supplement looks like as far as premium costs, drug estimates, your monthly estimates, and how that nets out. And they should be showing you something on the Advantage side. If anybody's only showing you one product, that's not, in my viewpoint, a proper plan comparison. There should be a lot of transparency. You should be able to see both kinds of products. Okay. And that's the bulk of the show.
Well, thank you, Ted. And right now we don't have any questions. So let's just say for someone who's, what would you say to someone who's on here? They completely slipped their mind, and they're like, oh man, I got to actually enroll here. Where should they go? Just right after this call or this week before that deadline?
Yeah, surely. Well, we knew this was going to be busy, so in my household, we have care for all the kids, and I'm going to be working with my company throughout the weekend, all the way up into the deadline, which is midnight Central Time on Sunday night, December 7th. So they can reach out to me. I have my number here. You can reach out directly. You'll find me there. You can send me a text or you can send me an email, or you can just go to the website and check out what we're all about and get in touch through info@nextstagebenefits. But we're preparing for people to be, people are so busy these days, things just kind of take a while to get done. So if anybody still needs that help, we can guide them through the process. We can look at what they have today and see if it makes sense to move. Sometimes they're in a good spot and we confirm that as well. And if it isn't broke, then there's no reason to fix it. So that's how we'll be supporting folks. And I'd encourage people to reach out if they need some last minute help.
Awesome. And then the other question I had that we hear a lot from clients is, okay, so you're turning 65. Let's say you're turning 65 in January. You still work at your company, you love what you do, and you have no plan of retiring in sight. Okay, you're planning to retire at 70. What should they be doing in the year that they turn 65 that would set them up for success? Obviously, they could talk to you. What are some things that they should be thinking about?
Yep. The first is they want to make sure the company has 20 or more employees, because that is the line in the sand that's drawn where your health insurance is considered creditable coverage and you can therefore delay Part B. So that's super important. If it's less than 20, you need to sign up for Medicare because it's going to be the primary payer. So that's the first thing. If said company is 20 or more employees and you have credible insurance, you have the option to sign up for Part A. So you can sign up for Part A and continue to delay Part B. And the reason somebody would do that is you're going to get the benefit of Part A for free because it's premium free. And you would not take on the premium that is associated with Part B. So you can sign up for A, you're going to get the benefit where your group insurance will be the primary payer, your Part A will be secondary payer. And then what we do is when said person turns whatever age they're ready to retire, we know that they have had creditable coverage. We have the L564 form filled out. They fill out the top. This goes the same for a spouse that might be under the plan as well. You get one form filled out for each. The HR or health insurance administrator at the company fills out one piece. It shows that you've had coverage from when you turn 65 until this time, and we submit that with our application for Part B. So those are some of the big distinctions. One more I'll mention is the only time we recommend people don't sign up for Part A is if they are contributing to a health savings account, because there can be a tax implication there. So that's something to talk through if somebody has an HSA.
Got it. Yeah, thank you for calling all that out. And then we have one question from Kevin, and he asked, can you speak to county differences in plan options in Massachusetts?
Yeah, generally, you are correct in that this is all driven through county, and that's why you need to input your zip code when you're on a tool like Medicare.gov or if you enter into an insurance company's website. The specific differences are um, much too vast for every single plan, but I can confirm that there are differences between counties, sometimes more drastic than others. Like I have one insurance company that is no longer offering their PPO in Suffolk County, but they are in the rest of Massachusetts. So I can confirm, yes, if your um, inclination is there are a difference based on counties, that's exactly how they actually map them out at the insurance companies. To each specific county, we'd have to drill down into specific plans and a specific carrier because it kind of goes down deep into what each insurance company is offering on a county by county basis.
Great. And and Kevin was raising his hand, so I'm assuming that was the question. So if anyone else has any other questions, I'm happy to feel free to raise your hand as well. But thank you for that, Ted. Okay, no questions here. Again, thank you everyone for coming. Really appreciate you taking the time. And we are both here as resources. Feel free to reach out to either of us. We know this can be daunting, and we're here to help as much as we possibly can. And this this has been recorded, and we will be able to share a recording with those who are looking to watch it again or would like to share it with anyone that they think that would benefit from this. So, with that, have a great rest of your day, everyone, and a great holiday season. Bye.
Thanks, Andrew.
Thanks, Ted.